The platform and techniques that I use to score a band 1 in SJT. As I talk through my tips and tricks for this section, the best way to do this is by approaching a question together. So let's find a situational judgment question here. Feel free to pause and attempt the question yourself before I go through the techniques that I would use. My first tip is reading Good Medical Practice by the GMC, as that highlights the main themes that SJT could ask you about, which from skim reading this question I can see is honesty and probity. Tip number 2, always prioritizing patient safety, which makes me select that this is a very appropriate thing to do because you don't want to put the patient at risk of infection. And that is the correct answer, as we can see here, which leads me on to tip number 3, which is to not think about what you would do in the scenario, but what you should do, especially according to the GMC guidelines on the expectations for a medical student and a doctor. The platform I used for all my UCAT prep was Medify, and that's also where today's question is from. Aside from the 20,000 plus questions that you have access to, one of my favorite Medify features is that they have section-specific mini-mocks that you can practice according to the question types that you're getting wrong. Head to the link in bio to get started.